Hi, I'm Dr. Megan Crute and I'm a board-certified dermatologist with CallonDoc. Today I wanted to discuss the issue of sun poisoning, what that entails, what to keep an eye out for, and how to potentially avoid it or treat it. So when people state that they get sun poisoning, most of the time what they're actually getting is a skin rash called polymorphous light eruption. This is almost like an allergic reaction in the skin due to stronger or more intense UV rays. And what happens is it causes a rash that typically causes red, bumpy areas that can be fairly itchy for people. Sometimes it's in all the areas of skin that have had this stronger sun exposure, and sometimes it's just in random areas. But the key to it is more intense sun exposure. So most people do notice this kind of in the spring or summertime with the first big exposure to sun that they have, or if people go on vacation to an area where they have more sun exposure than they typically have at home, it can also occur. This can cause, like I said, a very uncomfortable, itchy red rash that can persist for a few weeks even. You know, the best treatment for this is to have sun avoidance or sun minimization protocols in place. So definitely utilizing sunscreen with an SPF of 30 or higher on any exposed skin, reapplying frequently, and especially after swimming or sweating. Good sun minimization can help to prevent it potentially. Wearing sun hats, sunglasses, sun protective clothing can also help. Trying to stay in the shade during the middle hours of the day are all helpful. But people who are susceptible to this sometimes notice that it recurs on a yearly basis or anytime they get more significant sun exposure. So in that case, when it does happen for those patients, a lot of times we can treat it with a topical steroid cream because it's anti-inflammatory. It will get the itching, redness, and rash calmed down faster than just waiting it out. Sometimes we do have to use steroid pills to treat it if it's a more extensive rash. But if you go out in the sun and you develop an itchy, bumpy red rash, chances are it could be this polymorphous light eruption. There's also a slight chance it could be a contact dermatitis where an ingredient in your sunscreen might be interacting with UV rays and causing a rash on the skin. So that is one possibility for what may be happening when people think they have sun poisoning. Outside of that, sunburns definitely can happen. That typically is reddening of the skin in any areas of more sun exposure. If it's bad enough, it can cause swelling, blistering, and overall can just make you feel pretty crummy. So if it's in localized areas, you know, using cool washcloths, ibuprofen, aloe vera gel, those can all be helpful. If it's getting to the point where you are feeling ill with, fevers, chills, things like that, it's probably best to get checked out because you may be dehydrated and having too much inflammation going on overall. Beyond that, you get into things like heat exhaustion and sunstroke, and that goes beyond just sunburn where you're having issues where again, your temperature is rising, you are losing a lot of fluids, so it's very hard to stay hydrated. You can even get severe headaches. You can be in a very dangerous situation when this happens. So again, if you are experiencing sunburn and it's getting to the point where you're feeling ill, or even if you don't have extensive sunburn, but you've been out in very hot weather and you just are in general are not feeling well, and trying to hydrate yourself in general is not helping, it is best to seek help because sometimes you need additional medical care to recover from that. So if you are someone who experiences a itchy, irritated rash after being in the sun and you know it happens pretty much every year, talk to your dermatologist about what could be going on and what you can potentially do to treat it, because we want people to be able to enjoy their summers, and we definitely have options to get people more comfortable if something does happen.